Well, thank you. As I said in the beginning, we are very, very lucky today. You know, now the whole discussion in Ghana now is on COVID-19, coronavirus. So I was thinking today would be a great day to have a doctor in the house so that he can take us through a very solid piece of education and open our minds so that we understand the whole virus better and how we can best protect ourselves. And we're very, very lucky because the gentleman we have here in the house today, he's a senior emergency medicine specialist, currently with the University of Ghana Medical Center. He has a whole history, but we bring him on the show so that we can talk more about emergency medicine and anything you need to know about the coronavirus. So put your hands together. Welcome, Dr. Takyi. Okay, there we go. Thank you, John. Well, you can see that we have moved from handshakes now. You know, we are into a new era in Chebu. You saw the doctor taught me this style. We'll show you some love now. Dr. Takyi, welcome to the show.
Thank you very much, KSM.
And I'm so happy that you're here today, and we are lucky to have you here today. Thank you very much for coming.
Pleasure is all mine.
Before we start, emergency medicine. This is the first time I was hearing from you when I was talking to you earlier. What is emergency medicine?
Emergency medicine is a new specialty worldwide. But in Ghana, it started somewhere around 2009, where the training started. Ghana College of Physicians and Surgeons started the training, and I was privileged to be part of the first class.
Oh, so you're a pioneer
Yes.
of emergency medicine?
Yes.
Oh, and you did that at University of Ghana Medical School?
No, Ghana College of Physicians and Surgeons.
Oh, Ghana College of, okay,
But the training center was at Konfanochi Teaching Hospital. So basically what we do is that, if most people remember or can reflect when they watch movies, when people are brought to the hospital, there's a group of people, a team of nurses, doctors, and at times other cadre of health professionals that receive, and everything moves on seamlessly, smoothly, so if they need to go to theater or ICU or somewhere. That is what we do. So when you come to the hospital and you have an emergency, in the past, you have to be distinguished between its medicine or surgery. But now, we don't do that. Anywhere that you have an emergency physician, once you come to the hospital emergency sector, you are taken care of by the emergency physicians and the team that work with him or her till you are stable to be handed over to the other specialties. So that if you have a life-threatening condition, there's no delay, or delay is minimized. Yeah, basically that's what we do.
Wow.
That's what we do.
I see. So the first point of call is with the emergency medicine doctors? Is that it? When you
Yes,
go to the hospital?
through our nurses, then us.
Okay.
So we have emergency nurses and we have emergency doctors.
Wow.
Yeah, and
I find out rather surprised to hear that Konfanochi Hospital is like the center for emergency medicine in West Africa?
Yes. Konfanochi is the hub of emergency medicine training and practice in West Africa. Yeah, that's
Really?
true. Yeah. It's something good that is coming out of Kumasi and for that matter, Ghana, that we should all be proud of.
So if anybody wants to learn about emergency medicine in West Africa, they have to come to Konfanochi?
As it stands now, until
As
other centers are open elsewhere,
Yeah.
they have to come to Konfanochi through the Ghana College of Physicians and Surgeons.
Okay.
Yeah.
Okay. And you were once working, you set up the emergency unit at Tamale Hospital?
It was really an honor and a privilege for me to have been up north and been given that task. It wasn't easy, but by the grace of God, we reached a stage where, when I look back, I'll be proud of. Yeah, so I was the founding head of the emergency department. And I want to say that if you need the emergency department in your facility, the thing must come from up down. Management of the facility must want it. Because if it's from bottom up, there's too many opposition and it doesn't work.
Okay.
So I'm appealing to all hospitals out there that want to set up emergency department. There are a lot of good brains out there who can assist you. So they should reach out to us, especially Konfanochi.
Okay.
They'll take care of them.
So you can set up in their various hospitals.
Exactly.
Okay.
Exactly.
But as I learned now, for the University of Ghana Medical Center, you are now the lead emergency medicine specialist to set it up there?
Yes, sir. You are right.
Oh,
are
congrats, showing some love.
Thank you.
And anyway, let me say a big thank you to Dr. Say, and he's also the
Chief Executive Officer.
Okay, he's the Chief Executive Officer of the UGMC, and he's the man I called. I said, I want to talk about coronavirus today, and how can you help me? And he says, I'll get you the man who is on top to give you all the advice. So show some love for them, man. And Doctor, let's after the background thing, now let me get into the meat of the whole thing. This COVID-19 coronavirus, major, like, is it like a catastrophe or?
Yeah, it's a pandemic.
Pandemic, right? Okay. And can you tell us a little bit about this thing before we get into other aspects?
Okay. COVID-19, that has been now called, that everybody is aware of. COVID-19 basically means coronavirus disease, which sort of was discovered 2019.
Oh, okay.
So that's like COVID-19.
Okay.
And we've had coronaviruses with us for so long. People have even forgotten about it. A lot of coronaviruses cause a lot of diseases. Two major outbreaks before COVID-19 was MERS in Middle East and SARS. Most Ghanaians remember SARS. Yes. So these are all coronaviruses.
Oh, so
they all tend to get
coronaviruses.
Exactly.
Really?
Exactly. So you tend to get respiratory symptoms. So it can be mild, it can be moderate, it can be severe. Okay. So you can just start with just a cough, a sore throat, a fever, something like that. But basically,
where did the word corona just emerge from? Because people seem to announcing corona. So I to this moment didn't think it was MERS and SARS. Yeah.
And MERS.
And MERS. Yeah, I didn't link it to all of it being
Middle East respiratory syndrome, MERS.
Oh.
Then SARS.
I see.
Yeah, sudden acute respiratory syndrome, SARS.
Okay. But the word corona didn't come up then?
No. I think it was because this one, initially, they were struggling to identify what it was. And they weren't sure what name to call it. It's gone through some few transitions before the name COVID-19 was accepted. So I think they knew it was a coronavirus, but it was a different strain or a different type. So initially it was being called a novel or a new coronavirus 2019, which was too long. So they had to come out with something simple. So the COVID-19 is already a disease. So coronavirus disease 2019.
2019.
Exactly.
Okay. So now Ghana, we are now on tenterhooks, that it's gotten onto our borders. What is spreading it?
Coronavirus is a respiratory infection. So when people have respiratory infections, what happens is that once it's respiratory, it means when you cough out, you can bring something out. So if someone is close to you and you cough or sneeze, you could get it. If someone cough and sneeze and the droplet settles on surfaces and you go touch it, or someone sneezes into the hand, that's why I was talking about how to do those things properly. Because you can't restrict sneezing entirely. Once in a while you sneeze, so how to do it properly. And so we want to avoid all those things. And I think culturally in Ghana, we like handshakes a lot. And people take offense if they want to shake you and you don't even want to shake them.
Yeah.
So this is a real sort of challenge to Ghanaians and for that matter, the rest of Africa. So you have to stop doing certain things we used to do and take for granted. So with this disease on the loose, if you stick to the basic safety and preventive measures as adored by the Ministry of Health to the various agencies, I think we should be good to go. But basically when we start going to like the symptoms, the preventive, maybe then I'll touch more on it. Okay.
Well, let's get into it right away.
Okay.
What are the symptoms?
Okay. So the symptoms are plenty. Okay, but the commonest symptoms among them are fever, cough, and shortness of breath. But there's a whole cascade of some people come with diarrhea, headache, myalgia, runny nose, but it doesn't happen to everybody. But they realize that these three, fever, cough, difficulty in breathing, or shortness of breath, tends to be running through most of them. So for now, we don't want to make it too many for people to get confused. So fever, cough, difficulty in breathing, or shortness of breath. These three should be
three key ones.
Yes, these are the three key ones. Yes. So basically, I want to just stress on just these three for now. Because I don't want to give people so much information and they get confused. Yeah.
And these three, when you have them, definitely you need to check up, but they might not necessarily mean that you have COVID-19, right?
Yes, because there are a lot of diseases that can present like this. Somebody can have an asthma that can present with this. They may not be fever in this case, because the symptoms don't present in a particular order. Okay, it doesn't mean you have to have fever before the cough. They can come in any order. Okay, so, and we know even TB can give you this presentation. Pneumonia can give you this presentation. So we are not saying because these are the symptoms. It means when you have these symptoms, it means you have COVID. So there's something called case definition. So the case definition says that fever, sudden onset of, or acute onset of respiratory symptoms. Respiratory symptoms being either cough, difficulty in breathing, okay. Then you have had a contact with somebody who has been to a country that has confirmed COVID-19. Or you yourself, you have traveled, okay. Or you've had a contact with somebody confirmed as having COVID-19. That would do contact tracing and all that. So basically this, I don't want to, there are other parameters, but this is the simplest one. So if you have a fever and you have the respiratory symptoms and you've had a contact with somebody who had traveled to a country which has confirmed cases, or somebody who has been confirmed as having, or you've had contact with somebody who is very ill, because somebody can be very ill with a disease, has not been seen, so we may not know whether he has a case or not. So that's why we talk about social distancing and all that. Okay, when we get there, I'll touch more on that. Yeah.
I like when you say when you get there, because you're taking us there.
Yes.
So we'll stay there.
Exactly.
So these are the three main symptoms that folks you should look out for, right?
Exactly.
Fever, shortness of breath,
yeah.
and
Cough.
and coughing.
Yeah.
So if you have these three things, then that's like red flags, you know. It may not be that you have it, but definitely check it out. And let's move on now to where you got to social distancing. What are the rules regarding social distancing?
Okay, most literature have talked about 1 meter. Some have talked about 2 meter being the acceptable distance to be away. That when someone sneezes or coughs, it's unlikely the droplets will get to you. But I would say here on this show, the further you are from the person, the better. Because I don't think people can have a ruler walking about measuring 1 meter. So the further you are, when you see that someone is coughing, the better you are away from the person, the better. Okay, the books can mention all the variables, but these are all statistics based on available data now, which may change as we keep learning more about the virus. Okay. So social distancing means, they said 1, 2, I've heard 6 meters from other centers, but I would say the further you are away from the person who is sneezing or coughing, the better for you. Okay,
let's look at the situation where, like we are sitting here, none of us is confirmed with anything.
Exactly.
In that case like that, how does social distancing apply? Like in a work area, you know, like this, how do people cope with it? People are walking around, you don't know whether or not they have it. Do you just distance yourself from everybody, or how do you deal with that?
Okay, I'm happy there's ongoing public awareness about the safety and preventive measures so we don't spread the infection. Because I'll go a little into an area and come back. The health infrastructure of Ghana is not as sophisticated as elsewhere in the Western world, but they are even struggling. Okay, if you look at what is happening in Italy and other countries, they are struggling. So we don't have all those health infrastructure. So our best bet is to limit the infection and make sure once we get somebody infected, it just stays with that person. Hopefully he recovers, and that's it. So back to social distancing. As part of the preventive measures, okay, there are many things. Social distancing is one of them, okay? So one is, if you are coughing and you have a fever, we don't know whether you have COVID-19 or not. What we advise is that you stay home, minimize contact with people. If you can seek medical help, go and see a doctor, okay? Then that one, because you are coughing, I can advise you that put on masks whilst you go see a doctor. But I will not recommend everybody at all putting on masks, because there's no literature to support that if you put on masks and you are not sick, it will protect you from getting COVID. There's nothing like that.
So this whole thing, you know, there are so many people now walking around with masks.
Yes.
There's no scientific basis.
The fear with the masks for me and most of my colleagues is that it gives you a false sense of security.
False
Sense of security. You think you have the mark, so you are okay.
So, okay.
But research or available data now, because we are still learning a lot about this thing every day, and updates from WHO, CDC, and the rest. If you do the face masks alone, it's not good. So all the preventive measures or safety measures should be done or should be taken holistically. So we advise frequent hand washing with soap and water. Me and you know, or most of us know what happened in Accra recently, where people were buying sanitizers in drones.
They are
and
all
drones
out now.
Yes, and the advice is, I'll prefer everybody rather wash their hands with soap and water. When you can't get soap and water based on where you are, then the sanitizer becomes useful. Okay.
So soap and water is first.
It's first.
Soap water and running water.
Running water.
Running water is the first.
Yes.
Okay. Even before sanitizer.
For me, that is what it is. Okay. Because soap and water is the best form of hand hygiene. That's why when we are going to the theaters, we wash our hands with soap and water before we go inside. We don't use sanitizer. So I'm just using that to illustrate the point. So soap and water is one. If you are somewhere, let's say you are opening a door and you don't know who has touched the door, so you touch the door and you don't have soap and water around, you can use a sanitizer to rub your hand, okay, just to keep you safe. But as soon as you can get access to water and soap, I prefer you wash your hand. So that's one. When you are coughing, the advice is that you cough into your elbow with a flex like this. That's how you're supposed to cough. I've taught my 6-year-old, 4-year-old, and 2-year-old how to do that. When they are coughing at home, they do this. That's 6, 4, 2-year-olds. So it shouldn't be too difficult for adults to do that. Okay. And I know a lot of this, there's a lot of fear and panic in town, but I want to just reach out to everybody. Everybody should remain calm. Allow the doctors, nurses, public health professionals to do their job. Just adhere to the safety preventive measures, and we are good to go.
Let me ask on this, doing this when you're coughing. For me right now, sitting here with bare hands, is it quite effective, or I need to be in long sleeves, or I need to have my hand covered with some cloth before this is effective?
There was a joke where people said you have to put like a gown and all that. But for me, whether it's your bare hand or like a cloth like mine, when you are, let's say I have coughed into my bare hand, you just go to the washroom and wash it off. If you don't want to use your bare hand, you can use a tissue. As soon as you finish sneezing into your tissue, you dispose of it immediately and wash your hand. So it's like wash your hand, wash your hand, wash your hand. Yeah. Exactly. So it's not too much sanitizer. I want to drum home again, and for emphasis, I'm going to repeat: hand washing is the key to avoiding spread of infection. And I also said, if you know you are coughing, you are not well, there's no need of going around hospitals that want to be tested. Stay home, self-quarantine, call for help. If you don't have resources to self-quarantine and you can go to a hospital, they will screen you. If you meet the criteria, we'll isolate you, then we'll take your sample to either Kumasi Center for Collaborative Research in Kumasi or Noguchi. If it comes positive, we take it to the isolation ward or treatment centers. If it's negative, we investigate further what is making you cough. Just as a preventionary or precautionary measure so that we don't overexpose health staff. Because elsewhere in China, let me say globally, over 3,000 health workers have been infected.
Wow.
The chief of medical care in Italy died from coronavirus. And a lot of the Italian health workers were complaining of lack of appropriate PPEs. Because of what is happening, there's shortage. Okay, so we want to use resources wisely. That's why I'm coming back to even the face masks. People should stop selling face masks. And I'm appealing to those who own pharmacies and shop. Please, stop selling face masks. Stop it. Because if we keep selling to people who may not know how to even use it, and it runs out of the country, then when you come to the hospital, you are exposing unnecessary healthcare workers who also have families and live in communities. So I'm pleading to the pharmaceutical groupings that we have in the country, if they can restrict the selling of face masks to everybody at all. And I beg those who sell the hand sanitizers, please stop overinflating these prices. Because in crisis, you don't do that. So I'm appealing to all of you, please make sanitizers available to those who want them and make it reasonably priced enough for everybody to have some. And those who are hoarding, there's no need to hoard. When you hoard, you also deprive people from having access. And at the end of the day, if they get infected, it will come back to your doorsteps. So I want to just appeal to everybody. Let's do the normal things which we have been advised to do. The most important I have said on this show is hand washing. You see, there are a lot, okay, but hand washing for me is key. And back to the face masks. I went to the bank yesterday. There were people wearing face masks, the security guys, people wearing gloves. They will spray your hands with some spray solution. Then before you touch the keyboard or the ATM, and when you are done and all that, we should stop that. So I'm appealing to the banks, the managers and co out there who are authorizing the security guys to do this. It's not helping us. If your security man is coughing, let him stay at home or go to the hospital. I don't want people using a face mask and gloves and rather becoming source of infection for other diseases. Okay? So I beg.
Okay.
Oga and everybody, I beg you.
Yeah, let's take it a little bit further. So somebody is in a face mask, sorry. What are the risks that are presenting to the person and to other people around? Because you would think that, okay, I'm wearing a face mask, at least I'm protected, I can't get it from somebody, I can't give it to somebody either. But what are the risks? I want you to explain that a little bit more about this.
Okay. The first thing I'll say that face masks are for use in the hospital and for health workers. And for people who feel they are not well, they think they have some of the symptoms, so they are protecting themselves from spreading to others. Moving beyond that, if you are healthy, current available data does not support that when you put on face masks, you are protected. Okay, so let's stop it. So when you put on a face mask, as I've said, it creates a false sense of security. And I witness people, they have the face mask, but they keep touching their faces. And we've been told not to be touching our faces, not to be touching our mouth and nose. People are wearing face masks, and they keep readjusting. When you wear it for a long time, it becomes loose. It gets wet. So you keep adjusting, and you are still touching your face. So imagine if you wear gloves, you touch things, and you're still touching things, you may end up even infecting yourself, even with COVID, if you have come into contact with some COVID surfaces, or you may end up contracting some other disease. So that's why we don't advise that, because once you know your face is bare, you maintain a social distance. When somebody is sneezing, if you go away later, oh please, can you do this, nicely without shouting at each other? Then we all move forward. So I think I will not advise a face mask for anybody at all, unless you truly believe you are coughing, you have a fever, and you think maybe because it looks like. It's not always when it quacks or it walks like something has to be. It may look like. So then you can cover your face with a face mask and just present to the facility for you to be checked up.
Wow.
Yeah.
Wow. Well, we're going to go for a commercial break, but when we come back, we'll get into more of these things. Because what I am learning today is that face masks you don't need them until under very particular circumstances. Then I see people walking around. I was in a taxi the other day and the guy had a face mask.
Yeah.
I'm like, oh wow, people are really getting educated. I didn't realize that people are getting miseducated instead. Stick around. When we come back, more of the education. We'll be right back.
The KSM Show.